This virtual meeting provided us as partners in health and wellness an opportunity to collaboratively plan, facilitate and communicate to improve rural access, quality and efficiency in order to create a healthcare system legacy extending and learning from the disruptive changes of COVID-19. Over 950 people attended at 57 community tables across British Columbia. These answers were part of the virtual speakers corner. Attendees volunteered to participate in after group sessions.
The key priority that I would like to see actioned in the next year is to have us collectively focus on what we want, a vision for primary care and health services going forward. It's been really stimulating to have this discussion with the various partners in health services to help broaden the dialogue around what's possible and what would be appreciated by not only other healthcare providers, but also policymakers, administrators, patients, community. I think we haven't had a robust dialogue on what effective service delivery looks like in healthcare. We've been stuck in models of care for many years, and it's hard to change that. So I think the opportunity here is to envision different models and different ways of working together. I think the Pentagram Plus approach makes good sense. And so how can we use that as a vehicle to improve, clarify, refine our vision of what would be effective and to turn that into action as well? How can we use that to influence the development of models of care as well as structures for sharing information, as well as sharing ways of understanding whether those models have been successful or not? How can we also be learning from the practices that are trying different things within the province and learn to support and enable them better? How can we be learning from best practices outside of the province to stimulate our thinking and to challenge us to try things differently? Key priority. That's many things, but I think it's improving communication across sectors to develop a better model of care delivery and support its implementation in a collaborative, iterative fashion.
Okay, let me go first then, just to see what I wanted to just report to you briefly on what our group felt was important. We focused on provider wellness. There are a number of things we could talk about, obviously, but provider wellness in recognition that unless we have more or less happy and contented and thoughtful providers, the level of care will not be as good as it could be. And that requires, as Terry Eldred have said, the understanding of where and who we are and our own personal rootedness, and understanding our own personal biases, and to some extent accepting those, but being willing to think about how they interact with the person or people in front of us. So in order to address that, we felt that institutional teaching was an important piece. So the questions around whether that should be an integral part of any both teaching and development in a professional level, indeed any level, when a person is providing healthcare, but also, and very importantly, learning from the people that we're serving. That was a very important theme that we developed. And that learning is not something that simply happens over one episode or over an episode that might last hours, but actually over days and repeated. So that ongoing understanding and learning and sharing and collaborating is an essential piece in provider wellness and in our best service to those that we do serve. Thank you.
We were also talking a little bit about incorporating or like handpicking people during the hiring process that were already culturally competent. But in my opinion, I think what's more important is finding people that are willing to continue learning, even if it's something new to them and something that they've never had to encounter or challenge before in their lives. Because, I think that a lot of hiring or like a lot of positions are unfilled, and we can hire people at the moment, but as long as they're willing and open to learning about it, then find individuals that grow into roles.
I think I would describe it as finding the people who don't think they already are culturally competent. I don't think there's an end point on that, giving my certificate in cultural competency. I think it's an ongoing and a constant learning and exchange. And I don't know how you frame that question. I mean, I used to, my experiences with hiring a long time ago, that it was really interesting to try to design the questions that pulled out the folks that had a degree of humility. Because of course people come into interviews wanting to tell you about how great they are because they want the job. So there's a very interesting thing to be done there in terms of what would that look like? What would the question look like? That would help you as an employer understand whether the humility is there, that base, for that ongoing learning constantly. Somebody
that you can work with.
Yeah, it's really it, exactly. I mean, yeah. If I can make something complicated, I will, yeah. That's my role in community.
And I was struck by the report from one of our group members that we should be here to get it right, not to be right.
I like that one. Mm-hmm. Brene Brown, was it, that quote?
Yes.
I believe so. Yeah.
Yes. And that speaks to the equity in relationship, by the way, a lot. For me, it immediately strikes me we're talking about more equity, not, doctor knows best, not, but that real client-centered thing, some equity in relationship where the client, whoever you're talking to, their voice is extremely important, just as important as, the provider coming in with a set of technical and specialist beliefs and training, etc. Yeah.
In my
7, yeah. Oh, sorry. I was just going to say, I think after 75 years, I would have learned to speak or express, what's happening in my brain, but it hasn't happened.
The one thing that, to my mind, summarizes this whole piece is about respect, and it's respect for all, really. And you've put it well, Jane, with it's not that the doctor is right approach, but if we respect the person in front of us, and we respect our colleagues and those in the families and other relationships with the people with whom we interact, if that is something that pervades all of what we do, then we'll go quite some distance to getting this right.
Excellent. I don't want to cut you guys too short, but I know you have to go into your peer tables here at 10:30.
We've got to rock and roll.
Yeah, so thank you so much, guys, for this wonderful conversation.
Thank you.
Thank you. Enjoy the rest of the day.
Bye. Bye.